Hey guys, I'm Jackie Diffusco from News Channel 11, and this is my first ever web special. Today I'm going to take a closer look at some major community concerns that have really surged into public consciousness recently. Central are two bills that have really made Ballad Health the health system that they are today. I sat down this week for a lengthy interview with Senator Rusty Crowe. He is the senator representing much of Northeast Tennessee and Nashville, and he's been widely criticized for some perceived conflicts of interest in relation to these bills. Well, I took critics' questions to the source, and hopefully by the end of this video, you will have a better understanding on the debates on both sides of this controversial issue.
And that's what's so interesting about this. Some of the leadership that's concerned about this now are the same groups that ask us to please do this. You know, the city commissions, the county commissions of these counties, of this whole region, and the Chamber of Commerce were very insistent we have to try to bring our two systems together, because if we don't, we're not going to be able to control our destiny, our healthcare destiny. And so, because we knew some big corporation like HCA would come in and take over. And so to do that, the Hospital Corporation Act that you mentioned had to be amended to what was called a COPA, a Certificate of Public Advantage. And so what had to be, and what that wasn't us saying as legislators, we're going to merge. That was simply a bill that we passed as a tool to let the state decide whether or not, the two systems, if they merged, would be as good or better for patients from a perspective of quality and service and accessibility, as good or better than when the two were competing. And so that was done, and the state decided, yes, that was the case, that it would work. But what people, I think, don't understand sometimes is that COPA Act was really what I called, it was more like a community protection act, because it put in place a situation where in the Attorney General's office, the Department of Health, and Ballad had to work together, and the state, through the Attorney General's office and the Department of Health, continually monitor everything they do, everything. What had been missed, I think, was that once everything goes to the state, and in this situation with COPA, everything Ballad does goes to the state for review and acceptance or denial to the Attorney General and through the Secretary of Health. Once that goes to the state, it immediately becomes an open record. So all those things that all other hospitals get to hold as proprietary from a business perspective, so that their competitors, in Knoxville or wherever, Asheville, wherever it may be, can't just then use that to hurt this system. All those business level proprietary things, they would then have become open record. And so there had to be a bill. They came to us and said there has to be a bill to protect those proprietary items that all other businesses and hospital systems get the whole proprietary. So we had to pass something. That's when I got together, because I'm not an expert in that, and obviously, we all studied this, but I wanted to make sure that everyone was okay, and the process was as open as it could be. So I brought in the Attorney General's office, I brought in the Secretary of Health's staff, and we brought in Deborah Fisher, who is the Executive Director of the Tennessee Open Records Coalition. And then I talked to WJHL, Nate Morbido and Johnson City Press, all together to make sure everyone felt comfortable with the way it was done, so that nothing that was closed as records was closed that shouldn't be, from that perspective that you want an even playing field with other hospital systems, whatever they can keep proprietary and those sorts of things. So that's what was done, and that's where it is now. And I don't know how much more inclusive we could have made it, with making sure everyone was at the table to ensure that nothing was closed that shouldn't be. Any expert in this field would agree it's the most open system in the country right now, because not only were those things only those things that are customarily kept private, and it was done by the Tennessee Open Records Coalition, and they're the watchdog, You know, they immediately go crazy if something's going to be held, you know, proprietary. So it was done in those terms. Obviously, if there are things that need to be amended, then, you know, that's always an opportunity to do that.
Now in my hand, I am holding 69 sworn affidavits that concerned citizens tell me they plan to submit to the Senate Ethics Committee as formal complaints in hopes that they will open an investigation into Senator Rusty Crowe's potential ethics violations. Let's see what he had to say about that.
I'm not an employee. I contract with them to try to make sure that physicians and patients understand wound care and hyperbaric medicine and what's going to happen to them. And when they refer patients, make sure they know when the patient's treatment is ended at that point, make sure the physician understands that and that the staff does. And so I've worked in that for years. That's what I've done for many, many years, long before Ballad was even. And so we all have jobs. Lawyers in the Senate vote for all the legal bills. The insurance agents vote for insurance agency bills. I mean, there's that. That's just part of it. So we all do have those conflicts. But what we do, Jackie, is we make sure that we take what's called Rule 13, which essentially says, I understand I have a conflict with this. However, I'm making the open statement that I'm going to vote honestly and prudently, you know, for the people I represent on this issue. And then we file a disclosure statement where you have to say where you're getting your income and who you work, who you contract with, and that sort of stuff. So, and I've done all that, you know. So that's just something we traditionally have to do in Tennessee because we're a citizen legislature, and it's hard to avoid those things. And when it's something in your district, then it comes to you as the senator to deal with it. And really, this bill, you know, if we hadn't passed the COPA legislation and the state had not approved it, then HCA would have come in. I would have been doing the same thing for HCA, you know, because of all the different physicians that I worked through and all that. So it really probably has not affected that at all, you know, and as far as benefiting from it. I haven't got any bonuses or any money to do this or anything like that. I've just always contracted. Other legislators contract with Ballad as well. You know, I'm not the only one. Generally, it's not something that I think I would personally benefit from. You know, I don't know of any personal benefit either one of these bills has given me. I would have been working for whomever came in doing this anyway.
Do you know how many times you've actually had to claim Senate Rule 13?
I don't know, many, many times.
They want to know if you have ever claimed Senate Rule 13 and then I guess not voted in favor of the bill.
I don't think so. I don't think so. I can't recall that I have. I'm not an expert in this area, but I can tell you that from what I've heard and what I've been told, complaints are made public once there's corroboration of fact that the complaint is a valid and honest complaint. You know what I mean, Jackie? I don't know at what point it becomes public. I think that it becomes public at that point that there's corroboration of fact and you know it's an honest, valid complaint.
Do you see a possibility, I guess, for changing that or making that a little bit more transparent, or at least opening the discussion?
Yeah, I don't know. I could certainly see a discussion about it with like I did with the open records bill to get the right people at the table and decide that.
As far as like your vendor contract will go, like what information is currently not public that would be made public if, say, that was disclosed with an amendment?
Yeah, I don't know. I guess the way Ballad puts together contracts with all the other vendors is probably pretty much the same. I'm not sure.
You're saying you don't know what information, additional information will be made public by that.
Right.
Probably the contract, no?
Yeah, I guess. Yeah.
I mean, I guess on its face, would you have any problem with that being public information?
Well, I want to be treated like a contractor would in any other business or any other hospital system. That's all I want. Yeah, and that's I think where we are.
What disadvantage might that put you at, or I guess maybe just elaborate on why you wouldn't necessarily want that information to be public?
I don't know. I just want to be treated like anyone else, any other contractor or vendor that would be in those hospital system circles or businesses, and that's what I guess that's what I didn't even think of myself when that bill was being drafted. I didn't draft it. It was drafted by the experts that sat around, as well as talking to the press and the Open Records Coalition. They drafted that, not me. And so I felt comfortable that it was done honestly and as openly as possible, and that anything that should be open was made open. From what I've heard, and I'm not an expert on this by any means, but from what I've heard, I think one of the concerns with making public when you're going to have a material change with some service line, like a surgery center, or like I think in Carter County, the surgeries were moved to Johnson City at one point years ago. If you make that public too soon, before you're sure you have to do it, then all your staff and physicians leave, and the patients are left there without the service. And so all I know is that traditionally they've made public those kinds of changes once the decision is solid that you're going to have to make a change. You know what I mean? Because if you make that public too soon, when you're not sure if you're going to have to, it's still just a business discussion among the people that have to make that decision. Then you're left without people at that hospital to serve the patients, you know, and you're in trouble. So I don't know, but I would think that's probably where that discussion will center around. You know, at what point do you make it public? Yeah, obviously, if it's a true change, it becomes public at some point. But I guess what they're asking for is to be made public sooner. But I think that's probably the crux of the debate. When do you make that public so that it doesn't damage the patient's ability to be served with you know, the doctors thinking you're going to shut it down and everybody leaves. So I'm not sure, but that's probably the crux of that one. And those were the kind of discussions that took place around the table. I kind of remember that one, you know, when the Attorney General, Department of Health, and the Open Records people are all talking that over. And I think what they arrived at, it should be open or closed, is exactly what everyone else gets to keep, proprietary or not. I think I'd want to see what those House members do first, and then I think what needs to happen with that amendment is this: if there's something in it that the House members that she spoke with think could be passed and is proper to pass, then they need to try to do that. If none of it is something that they feel can be passed, then I would put together a memo stating for each requested piece of that change why they think it shouldn't be passed, why passing it would hurt the patients that we serve or the people we serve. You know, that's what I would do.
Well, that's a wrap for this web special, but you can find much more of my reporting on Ballad Health on my Facebook page, Jackie DeFusco, WJHL. And for much more on the topics that affect you and your community, make sure to watch us on News Channel 11 and check for updates on WJHL.com. For now, in the studio, Jackie DeFusco, News Channel 11, in your corner.